Good morning. First of all, thank you to Dr. Pisamai for the Thai edition of the briefing, as always. So today is Sunday, the 24th of January, 2021, and I'll recap the Thai language version as well as provide some additional information regarding the current situation here at the Center for COVID Situation Administration, as always. So firstly, Dr. Pisamai ended with a chart regarding three circles, as you saw on screen. The red first circle, the second cluster, which is yellow, and the third circle or cluster, which is green. So actually, we in the English version, we showed this yesterday once already, but just to recap again, that these are the three types of the three types of circles that we might have in a particular case. So the case in point yesterday, when we reported, was on the case that affected the CCSA. So the red circle is, of course, the first circle, yes, you see on screen there right now, the circle which is closest to the person affected or positive, found to be positive. The second circle, the secondary cluster in yellow, that's where we in the CCSA were, and the third cluster is the green cluster, the third tier, so to speak. So, of course, the measures vary according to each cluster. The last cluster in green, no need for any actions. The second cluster, which is the yellow, is to monitor actually the symptoms, if there are any symptoms that might come during the coming days. Also to wear masks and abide by the various measures. The first red cluster, of course, that's the cluster that's the most worrisome, and of course all of those people in the first cluster have to be tested for COVID. So that's what Dr. Pisamai ended with. I'll also touch on one issue, just to let you know that, of course, in Thailand, in general, we try to close the generation gap. And it's very important to hear from our younger generation. So, for example, sometimes we have, from time to time, certain dialogues with people of the younger generation, students and university students, to hear what they think about the COVID situation, on what we can do to improve our lives. And just on a personal note, just that this afternoon I'll have one of those many dialogues with younger people on video conference to learn about their thoughts about COVID in Thailand in particular. So I'd like to start off today with an important piece of information from immigration. That according to ministerial regulation of dated 25th of December 2020, which is in effect on the 25th of January, 1 month after, which is this coming week, all persons entering the kingdom must be COVID-free. So as you see on screen, there's an infographic from the immigration department there. Basically, it says that the new arrivals from abroad would require for the passengers to hold the certificate of entry certificates issued by the Thai embassies abroad. And the criteria according to this regulation is that new entries have to be COVID-free and free from other diseases, as you see on screen on the left box. So since that is the requirement, when passengers arrive and they have to go through the COE certificate process, receiving that from the respective embassies abroad. Therefore, the criteria that is required in this regulation is fulfilled already in the COE, because the COE requires a COVID-free certificate for new arrivals. So the COE, going through the COE process, will enable the person to be able to fulfill this ministerial regulation already. Now, for those already in the kingdom and who are renewing work permits, the COVID-free is not required to be presented upon renewing the work permit. So that's about the immigration regulation that is being enforced, that will be enforced starting next week. The general situation, moving on to that, we have slides coming up for you. Today, we have 2,860 active cases. Those in Thailand who are still being treated in the 2000s. All in all, since last year, over 13,000 cases and over 10,000 recoveries. So the numbers, we're getting there. I think we're getting there. The numbers are closing in with around less than 3,000 for a couple of days or weeks now. We hope that the number will be lowered in due course. Today, the new confirmed cases we recorded is 198. Of this number, 118 from local transmission, 73 from active case finding, 6 cases from within the state quarantine system, and 1 case found at the immigration checkpoint. The number of new recoveries we have for today is 119, which is added already in the cumulative number of recoveries over 10,000 that you see on screen now. Unfortunately, we have 1 new fatality to report, making the accumulated total of fatalities at 73. This case, the 73rd case, is a Thai woman that is 73 years old with underlying illnesses and from Samut Sakhon province. It came within the context of COVID positive, meeting a COVID positive person. So our sincere condolences to the family of the fatality. The briefing by Dr. Pisamai, we showed some graphs and charts and maps as usual. So I'll just recap some observations in that regard. Firstly is that Thailand now ranks sort of in the same ranking as we had in the couple of weeks past, ranks 126 globally in the world right now. Most of the infections in Thailand have been found in Samut Sakhon province, up to 148, and in Bangkok, 2 cases. This is for today. The infections in terms of week on week, week by week, is lowering. As you saw on the maps that were shown by Dr. Pisamai, there were a couple of maps there, and on the 3rd map, that's particularly regarding this week, the map of Thailand has actually started to become colored whiter than the other weeks, meaning that this week, compared to other weeks, there has been less spread, less concentration in various provinces. So, for example, 3 weeks ago, there might have been a lot of yellow provinces, meaning that it spread, particularly for that week, it spread to many provinces. But for this week, it has been concentrated on only a few provinces, fewer provinces. So most provinces are white colored in that map for this week. The accumulated number of provinces that have been affected since the beginning still remains, however, at 63 provinces. The active case finding in Samut Sakhon continues and are still carried out intensively. Found over a lot of infections in the area, and many have also been tested. Over 10,000 testings, active case finding per day, and this is growing according to the plan. It's expanding. So that it can become easier to control the spread. We also mentioned about the factory quarantine. The factory quarantine, in particular, the deputy governor of some provinces were here at the CCSA daily meeting this morning, and they reported about their readiness in terms of isolating people who are infected in these factory quarantines for workers to help prevent the spread. So that's one good update that we have about the 100% readiness in terms of the factory quarantines, which in fact are, of course, the source of the major concentration of the new wave, so to speak. With the more intensive measures that we are carrying out, leading to the end of this month, January, it will lead to more relaxation, more relaxed preventive measures, hopefully, which hopefully will also include the schools as well, reopening up of schools. So the week next, the week of the 25th to the 31st of January, it will be the week that we will be carrying out the highest level of prevention measures to pave the way for possible nationwide relaxation of measures. Of course, pending that we carry out these measures to the maximum efficiency and receive the full cooperation of the general public. So just some additional information that is useful to the English language audience. In line with what I just mentioned about more provinces, the possibility of more relaxation, that more provinces are set to ease lockdown measures. As the number of infections have become more stable, several provinces have been deciding to move forward in relaxing certain lockdown measures. One of these provinces is Phuket province, where no new cases in Phuket have been reported for 29 days straight. It's very glad to hear, because in last year, Phuket was a case in point. But for this new wave, Phuket will no longer require travelers from other provinces to scan ID cards before entering the province. And visitors from highly controlled red zone provinces will no longer need to quarantine themselves, self-quarantine for 14 days when arriving. However, people traveling from highly controlled red zone provinces will still need to undergo temperature checks and pre-register their arrival in Phuket at the website www.gophuket.com. And Go Phuket, this is spelled go.phuget, it's not K, gophuket.com. This is the website for pre-registration for Phuket, and you have the infographic there up on screen. So in the meantime, travelers from the highly controlled or the dark red zone provinces are still required to undergo quarantine for 14 days when arriving in the province. Meanwhile, Ayutthaya province will start reopening health establishments, spas, and massage parlors if these businesses are able to strictly comply with the control measures. For Nakhon Ratchasima province, yes, you had an infographic on Ayutthaya province there on screen now. For Nakhon Ratchasima province, they've also announced that travelers from the controlled zones or the orange zone areas will not be required to undergo self-quarantine. Travelers from highly controlled provinces or red zone who plan to stay overnight will have to report to the provincial health officials and observe strict control measures and report to a health officer or disease control officer within 12 hours if they are planning to stay more than 14 days in the province. Then again, please check with the provincial measures for each particular province that you are traveling to. For Nakhon Ratchasima, they further informed that any gathering of fewer than 300 people is required to be reported to the district public health office, while large gatherings of 300 people has to be approved by the provincial communicable disease committee. Moving on to an important information in terms of the in terms of the private sector, the business sector, guidelines for food delivery businesses to prevent the spread of COVID. So during this situation, food delivery seems to have been one of the most useful services. I've ordered it, our friends have ordered it, of course. It will keep us happy because we are able to, of course, dine and consume the food that we usually would like without having to go to the restaurant itself. So since the delivery workers are among the most exposed to the virus and they move around the city all the time, they meet many people all the time, the health ministry has announced a set of guidelines for food delivery staff to prevent the spread. The list you can see on screen there in an easy to understand infographic, courtesy of the Public Relations Department. It includes the close observation of the information, the preventive measures, the maintain at least 1 meter physical distance from customers, avoid leaving food on the ground. And for customers, it's suggested that everyone should wash hands immediately after receiving food delivery, and if possible, pay for the food delivery using e-payment or prepare an exact amount of cash to avoid any unnecessary contact. information on the different types of COVID tests. It's safe to say that all of us have been informed from time to time about how one can carry out preventive measures against COVID. And pretty sure that by now you all know DMHTT by heart now. However, on COVID testing methods like PCR, that's not been talked about so much. So today, just briefly on that. The PCR test, a method widely used in many countries, including Thailand, used to detect RNA, which is the genetic material of COVID. That is why the doctors have to take a swab test at the back of the nasal cavity through your nostrils, which is quite an unpleasant experience, if you ask me, because of course, recently, just 2 days ago, we here had to undergo that test ourselves. And even though the swabbing process is quite uncomfortable, the PCR test is one of the most accurate methods we have to detect COVID infections. And currently, there are about 250 specialized labs in Thailand accredited to do the PCR testing, and at least one lab located in every province. For more information on COVID and on the general picture of PCR, you can check also the social media and Twitter account of the World Health Organization or their website, worldwideweb.who.int/Thailand. So before ending, just some closing thoughts. That with the active case finding missions being carried out every day in Thailand, in Samut Sakhon and other areas, the number of infections might fluctuate up and down because we're finding cases. We're finding cases from our active case finding, and we'll continue to do so, and it will continue to go up and down as long as our health officials, so to speak, go into the deep end of the pool to try to search and root out those who are infected in different communities, and to carry out the tests on the public to find as many infected persons as possible to best control COVID in Thailand. So on behalf of the CCSA and everyone here, both Thais and our friends of Thailand, just once again to express our thanks and gratitude to the frontline health personnel doing the active case finding, all the doctors and nurses, as well as everyone involved in the process, in the risking themselves to keep all of us safe from the pandemic. So it's Sunday today. We, of course, love working on Sundays if it's of public importance, if it's of use to you. I hope all of us all of us have been providing good information to you, and you've benefited from that. You've benefited from that. So, of course, next week we hope for a healthy week next week, and I leave you with a quote today from the United Nations Secretary-General Antonio Guterres. We are in this together, and we will get through this together. เราผจญกับวิกฤตนี้พร้อมกันและเราจะผ่านพ้นวิกฤตนี้ไปด้วยกัน So thank you very much for your kind attention today. Have a great and restful weekend, and more power to working next week, and we'll see you again tomorrow on Monday. Thank you very much. สวัสดีครับ